chairpersons, Dr. Acharya and Setia, esteemed members of the IMA and guests. The ethical use of newer vaccines. 250,000 people die of hepatitis B each year. This is data that was presented by Dr. Mark Miller, published in the journal Health Economics. The ICMR data suggests that only 5,000 died. So I wrote to the journal Health Economics and said I would like to see the model that Dr. Miller has used to get to the value of 250,000 people dying of hepatitis B in India. Dr. Miller wrote that a model stratified by income group and geographic region was used and that it was available on the CDC website. I went to the website, there was no model there. So what do you think? How do you think they were making this figure? I assumed that they were using data from Taiwanese males. The deaths in Taiwanese males is a world record. 1 in 4 Taiwanese males who are carriers of hepatitis B die of hepatocellular carcinoma or cirrhosis. This mortality is 300% the mortality rate in women in Taiwan, and overall it is double the mortality in Taiwan itself. It is 17 times the mortality in Canada. However, if you extrapolate the data on Taiwanese males on the whole population of India, if 4% are carriers and 1 in 4 dies, then 1% of all deaths in India must be due to hepatitis B. And 1% of deaths in India is 250,000. And that is how they arrived at this figure. I wrote up this model and sent it to the Lancet and said that Miller has not published his model. This appears to be the model. Lancet published it. After that, I wrote to the journal Health Economics saying that Dr. Miller had said previously that his model was on the web. It is not there. We have now published another model. Dr. Miller must either publish his own model or retract his paper. Dr. Miller wrote, and this is published in the journal Health Economics. All the references are given on the screen. Miller replied that his model was lost. The paper has not been retracted as yet. H. influenza disease, HIV disease, invasive H. influenza disease is rather rare in Asia. It's about 1/10 in Asia than what it is in the West. We have about 9 per 100,000. There is this editorial which came in the journal of in the bulletin of the WHO, which asks, is Hib vaccine really required in Asia? It is felt that there is natural immunity in Asia. How do they come to this conclusion? Because whenever they have tested pre-vaccination antibody levels at 6 weeks, the levels are so high, higher than post-vaccination levels. Now this could be passive immunity achieved from the mother. However, studies have shown that the antibodies continue to increase even without immunization, which suggests that it is active immunity. After vaccination, the antibody levels rise about 10-fold higher than it does in the West. This suggests that they were already actively immune prior to vaccination and the vaccines acted as a booster. Vaccine manufacturers are not easy to convince. They suggest that the reason why we are not able to culture the organism is that our microbiologists don't know how to culture H. influenza B. They say that there are special culture mediums in which it can culture better. However, there are several animal modules which show that organisms like E. coli have cross-reactive antigens with the H influenza B. And it has been published that these infections are very common in Asia, and perhaps why we have active immunity against H influenza B. This is the suggestion of the vaccine manufacturers, that if you use this particular medium, you will get better cultures. To prove their point, the Invasive Bacterial Infections Control Group set up shop in India, and continuously for 4 years in 6 large hospitals, they performed the cultures themselves. At the end of that, in 4 years' time, they had 125 cases positive. The paper suggests that this doesn't prove that Hib is not common in India. It may be that these hospitals like All India Institute are so inaccessible to the general population that all those people with Hib may be dying at home and not able to reach the hospital. They suggested that a community study needs to be done to know the real incidence of Hib invasive disease. Now, community studies are extremely expensive. However, the WHO funded the study. They did the study in Tamil Nadu. The incidence of Hib meningitis was 7 per 100,000. You remember 9 per 100,000, which was predicted by Levine? This was 7 per 100,000 for meningitis. This paper says that the low Hib in this region may be because of genetic factors, early exposure to bacteria with cross-reactive antigens. At last they recognized cross-reactive antigens, and low bacterial virulence. Now, if the culture media is not the cause why we are having low numbers, because the IBIS study has shown that even with good culture media, the numbers don't increase. Access to the hospital is not the problem, because community studies have shown the numbers are very low. What can be the explanation? The explanation now given is that antibiotics are so rampantly used in India that you can't get cultures positive. Solution? Probe studies. In probe studies, you identify the reduction in clinical disease. Don't need to culture. If those who are vaccinated have less pneumonia, all those pneumonias must be because of Hib disease. Therefore, even if people have been given antibiotics, you will still get the pneumonia first before the antibiotics is given. So they were looking at clinical disease rather than culture positivity. They did the study in Indonesia, in Lombok, 55,000 children, double-blind, Hamlet randomized, active surveillance, an excellent study. What they found was that there was more pneumonia in those who were vaccinated than those who were not vaccinated. Not statistically significant, but all the same, more pneumonia in those who were vaccinated. Study was repeated in Bangladesh, not as well done. It was not randomized or blinded. Only 35% received the vaccine. Here too, there was no statistical difference in the numbers who had meningitis or pneumonia in those vaccinated compared to those not vaccinated. Now let us see what the press release after the Bangladesh study said. Now press releases are important because that is what the public read. That is what the decision makers read. That is what government reads and makes their decision. The press release released by the WHO, by a large number of organizations, including the UNICEF and Gavi, the Johns Hopkins Hospital, all of them had a joint press release which said the new study shows Hib vaccine protects children from significant burden of life-threatening pneumonia and meningitis. The scientific paper says something completely different. The press release says something which they want the government to hear. This whole thing was exposed both in the Indian Journal of Medical Research as also in the BMJ.